Jeepers creepers, are your peepers bothering you? Stay tuned to Connecting Our Community. We're going to talk all about your eyes. Hi, I'm Pat Shoemaker. Welcome to Connecting Our Community. Our guest tonight is Dr. Maria Scott, an eye doctor extraordinaire from Chesapeake Eye Care. Dr. Scott, welcome. So I say you're an eye doctor, but that could mean so many different things. Can you tell us about the different, names for eye doctors and what they all do?
So I think it's sometimes very confusing, but there's a whole team of us that take care of patients and their eyes. The optician is the one that gives you your glasses, and it can be a certified optician, or it can actually be someone who's gone through several years of training. And then there's a doctor of optometry, fits contact lenses, prescribes glasses, can do diagnostic tests and treat some diseases. And they go 4 years of college and then 4 years of optometry school. Some of them will do a residency in a medical clinic as well to get more training. I'm an ophthalmologist. I went to medical school for 4 years and then did a residency for 4 more years in ophthalmology. We do surgery, treat eye diseases, cataract, LASIK, retinal diseases.
So if I just feel like I need glasses, should I start at the top with you? Should I start at the bottom with an optician? What is
there's
the
no
basics?
top or bottom.
Oh, okay. Sorry.
But you don't want to start with an optician because you need a prescription for glasses. So the first thing you would do is either go to an optometrist or an ophthalmologist and have your eyes checked, make sure they're healthy, and then get your prescription for glasses. And either one would work fine.
Okay. So an optician is just someone who makes the glasses but is not a doctor.
Correct.
Did not ever go to medical school in most cases.
Correct.
Okay, so that's interesting. I didn't realize that. So healthy eyes, unhealthy eyes, they say that the eyes are the windows to the soul and also to your health. If you're looking at someone's eyes, you can tell if there are other diseases, not just of the eye. Is that correct?
That is correct. One of the notorious ones is someone has diabetes, long-standing, and never knew it. We can look in their eyes and see some damage that may have occurred, or high blood pressure. And there are some situations where you can save a patient's life because they've lost vision that could have also caused a stroke. So in those situations, you can.
Yeah. So what is it that you see so I looking out or looking at myself in the mirror wouldn't be able to see something? What do you see looking in that would be a sign of diabetes or high blood pressure or something like that?
So if we look at this model of the eye, you have the cornea here and then the iris, but the pupil is really a hole in the camera. Okay, so if you think of this as a camera, here's the filter, and then here's the lens, and everything gets focused on this retina. We look through the pupil onto the retina and the optic nerve, and we can see diseases that occur there, blood vessels that are attenuated. We can see bleeding back there, and that's how we can tell that you may have diabetes or high blood pressure.
That's amazing that you can see all of that through looking in. So there are a lot of diseases of the eyes. There's a lot of sort of myth that it's only old people who have these different kinds of things, but eye diseases can start at the tiniest babies, right?
Right. And it's really important for some of the eye diseases to be caught early because they are reversible up to a certain age. So if you have one eye that has great vision and another one that's really nearsighted or farsighted, the baby will turn off the one eye, and if we don't catch it before the age of about 7, the brain will never develop the ability to see well. Wow. So that's something that's reversible if we can catch it early.
Wow. So at what age would you suggest starting to have eye exams?
Right before school, 4 years old.
But unless there's a problem with a child maybe bumping into things or something, you wouldn't suggest like a 2-year-old or something?
Not usually.
Okay.
No.
So at 7, a child comes in for an eye exam, and what do you do? Is it the same eye exam that an adult would get?
It's the same exam. We test them for glasses, see if they're nearsighted, farsighted, have astigmatism. And we do the same thing. We check their pressure, make sure they don't have glaucoma. There are pediatric glaucoma, there are
Wow.
pediatric cataracts, and they can also have retinal diseases and glaucoma.
Really?
It's less common. You
Yeah.
think of a lot of those things that I just mentioned as things that we develop as we get older, and it's because it's more frequent in the elderly.
Yeah. Is it more frequent in the elderly, or do you think that as you get older, you are so used to going to the eye doctor that you go and those things are caught?
No, it's definitely more common as we get older.
Yeah, okay. And so what is nearsighted, farsighted? What's an astigmatism?
So, a great question. If you had a perfect eye, the light would come into the cornea, and the cornea and the lens would then refract the light so that it hits the retina in the right spot. If you're nearsighted, your eye is either too long or this cornea is too steep, so the light doesn't focus on the retina, but it comes to focus here, and by the time it hits the retina, it's out of focus, like a camera being out of focus.
Okay.
And if you're farsighted, it's just the opposite. Your eye is too short, or this cornea is not strong enough, so the light focuses past the retina, or it never gets into focus by the time it hits the retina. Astigmatism means that the cornea, instead of being like a basketball shape and perfectly round, it's a little bit more like a football. So you have 2 points of focus. You can have one here and one here, or one here and one here. So glasses, contact lenses, LASIK surgery, all of those things help to basically put the image that you're seeing coming through onto the retina, to focus on the macula.
Wow, that's amazing. That really is amazing because I have all those.
Or you did.
Yeah, exactly. So what other types of diseases are common in eye treatment? Is there just like everyone is going to get a certain thing, or?
Sometimes.
Yeah.
So after the age of 40, this lens becomes a little harder. And my daughter is 21. She has perfect vision. So she can see in the dark, she can see distance, she can see close without glasses, because this lens is changing shape as the muscles in her eye move. As we get over the age of 40, this lens becomes harder, and it's more difficult for it to change shape. So suddenly your arms are too short, and you have trouble reading the menu at night. And that's the first sign that our eye is aging. As this lens progresses to harden, you can then develop a cataract. And so what happens is the lens can get cloudy, as it does here, in a couple different ways. And so then you can't focus the light at all, no matter if you are nearsighted, farsighted, if you have all your glasses prescription right. Because everything's cloudy going through, nothing will be clear. You may notice halos at night, trouble nighttime driving, needing more light to read. You're going to the house and everybody else is saying, why are all the lights on? That could be a sign of a cataract. So that's very common, and it happens more often as we get older. So if we all live long enough, we're probably going to get them. But some of them can get them at 30 or 40 years old. I've taken cataracts out of people that young.
Yeah.
And then as old as 103. So.
Wow. Holy cow. Well, what causes, is there anything, not necessarily what causes these things, but is there anything that you can do, maybe as a young person, to stave off getting these things? Or is it just sort of inevitable, it's going to happen, just live with it?
Well, the first thing is you can't escape your genes, right? So if your parents had cataracts at a young age, you're more likely to get them at a young age. But UV light, wearing sunglasses, is probably the best thing you can do for your eyes, not only to prevent cataracts, but also macular degeneration. Steroid use can cause cataracts earlier. And even if it's a short course, maybe you have asthma and you've been on and off for 6 months, that may cause cataracts years down the road. Trauma, heavy alcohol use. So there are some things that you can do to help prevent it. Eat a healthy diet, wear your sunglasses, all the things you have to do anyway with everything.
Yeah. So should children wear sunglasses as well as
Absolutely.
adults? And again, starting at age 7, or do you think that children as young
as early as they can put them on? So, I remember having my baby have them on outside.
Yeah. So, and also, is there anything in a diet, like they always say carrots, if you eat a lot of carrots, that your eyes will be Good. No, you're
No,
shaking your head.
No, that's kind of, the carrots are an old wives' tale.
Oh, really?
But they do believe antioxidants can help, prevent macular degeneration and prevent cataracts because it's an oxidation process that's occurring. So some of the antioxidants and the foods that are high in antioxidants can
And what
help.
is macular degeneration?
So macular degeneration is occurring in the retina, and this is your whole retina, but there's a very small area called the macula, and that's where all that light gets focused, and that gives you the ability to recognize faces, to read a book. And if those cells start deteriorating, and if they deteriorated in the periphery, you wouldn't even know it.
Yeah.
But if you're unfortunate enough to have them deteriorate centrally, then you could start noticing a blank spot in the center of your vision. There used to be no treatment for it. There's a wet and a dry form. The dry form is the better, earlier form. 15% of the patients will go on to the wet form. There are now injections and treatments for the wet form.
Injections into the eye?
Yes,
Oh.
and even though it doesn't sound
Yeah.
like it's pleasant, it's not uncomfortable.
Okay.
And what it has done is it allowed people who were previously going to go blind from macular degeneration the ability to continue to drive and really live a very full life.
Wow, that's amazing. That's relatively new then.
Probably in the last 10 years.
Yeah. Have there been a lot of advancements in the treatments of things?
One of the things I love about ophthalmology is it is so progressive. Technology, when you come into our office, there's always a new toy or a new instrument for us to diagnose and treat. I've been in practice for 25 years, and how things have changed over the last 25 years is amazing to me, and it's one of the reasons I love ophthalmology. I love the toys.
Yeah, I would hate to be the person that they experiment on this. They say, okay, we're going to try this new toy on you for the first time. But the result of it is amazing, and there's so much. We're almost coming up to the break, but I wanted to ask you very quickly, what are floaters? Can you describe those
Very
really
common.
quickly?
About 80-85% of the people over the age of 30 can have floaters, so it's not an old age disease. If you're nearsighted, you're more likely to have them. And what happens is the jelly inside the eye becomes more like a liquid and it contracts. And it will pull on its attachments to the retina. When it pulls off, this gelatinous material would then be floating in here, and it's like dust on the camera lens. But it moves when your eye moves, but not at the same speed. There really wasn't a big cure for it, but now there's a laser that can break the floaters up and allow them to be a little less bothersome to a patient. But most patients get used to them with time.
Yeah. And with that, we are coming up to our first break. Please stay tuned because we're going to talk about surgery when we come back. We'll be back shortly. Thank you.
I'm Alejandro Escobedo. Music has always been my life, but that was almost taken away from me by hepatitis C. Thankfully, I received treatment and stopped cancer before it started. Yes, cancer. Most people don't know there's a link between certain viruses and cancer. I didn't know, but I do now, and so should you. That's why I've partnered with the Prevent Cancer Foundation. The 3 most common viruses linked to cancer are human papillomavirus, or HPV, hepatitis B, and hepatitis C. Every year, more than 27,000 men and women are diagnosed with a cancer caused by HPV, and up to 65% of all liver cancers are caused by Hep B or C. These cancers are preventable. Getting screened, vaccinated, and treated isn't scary, but cancer is. For more information, visit thinkaboutthelink.org. Together, we can stop cancer before it starts.
Hi, welcome back to Connecting Our Community. My guest is Dr. Maria Scott, and when I said that she is an eye doctor extraordinaire, I have to, full disclosure, say that she is my eye doctor extraordinaire, and that I just had cataract surgery. And honestly, if someone had said to me 6 months ago or 4 months ago that I would have cataract surgery, any kind of anything going on in my eye, I would have said, not a chance. This is not happening. I wore contact lenses for 30 years, and I still don't like to put in eye drops or have anybody touch my eyes. So
You were such a great patient, though, Pat.
thank you.
really were.
But you're a fantastic doctor. But cataracts are something that's very common. I have talked to so many people just out of the blue who said, oh, I have to have cataract surgery, or I was just diagnosed, or something about cataracts. And the idea of the surgery, which to me is sort of like the LASIK surgery, but maybe it isn't, that you have to keep your eyes open and something is going to come and be in your eye. But honest to goodness, this isn't an infomercial or anything, but it was amazing. I was in and out in about 2 hours, and I'm not wearing glasses or contact lenses anymore. And it was only a month ago that I had the surgery. So please tell everyone else, because I can describe it from what I experienced, but if you could describe what the cataracts are, what the surgery is, and maybe the advancements of what people think it used to be and what it now is.
The ability to restore someone's sight after a cataract is why I went into ophthalmology. Yeah. I mean, it's addicting to see the faces of people like you, the patients, the next day when they come in, and the elation they have. So cataracts are curable. You can go completely blind, and in many places around the world, unfortunately, people are blind from cataracts. But once you take the cataract out, it's a cure. So what happens is this lens that we talked about earlier can get cloudy. So it looks like this in a very dense cataract. So a patient can not see anymore. What we do is we go in through a tiny little incision smaller than this pen, and we go in through the pupil, break up the lens into tiny pieces, and then we implant this new lens into that same position. And the lens lasts the rest of your life. It never has to be exchanged. And it'll be in the grave long past when you're gone. It's acrylic, and it's very inert. The actual size of the lens is like that. And now we have the ability with this acrylic to fold it so it can go in through a small probe like a taco and then unfolds in the eye. So most of the incisions are self-sealing. They don't require any kind of suture, no patch. You know, people go home, they see well in the next couple of days. The biggest advancements that have occurred is in these lenses. So it used to be, when they first came out, that you would take a cataract out, put a new lens in, and you wore glasses afterwards. And we tried to get it close, but we weren't that great at it. Newer formulas and newer lenses were now able to correct astigmatism, as in your case. So what we do is we take this lens that it has more power on one side than the other. We put it in, we rotate it into the right position, very much like your glasses would be rotated, and that allows you to see good distance or good near. There are also multifocal lenses that allow you to see distance and close. My mother's 87. She had cataract surgery 10 years ago. One of the things we love to do is cook together, and she reads the recipes better than I do now. She drives to and from Philly like she's going to the grocery store, even at the age of 87, and has never worn glasses since her surgery. She's lucky. Yeah. One of the downsides of multifocal lenses is you can get some halos around headlights at night. By 6 to 8 months, 95% of the people say much improved. 5% of the people say never any better, but they love the fact that they have this range of vision. And only about less than 1% will say it's not for them, and we can exchange it if we need to, if someone just doesn't adapt well to it.
Yeah. I have to say, honestly, it was amazing. And I know that everyone in the control room and the crew here are going, ew. But which is what I did until I had it, because you do have to be awake.
Yes.
I
need your cooperation.
Yes, because you have to be able to see, to say, yeah, there's a little red dot or whatever the case may be, but you don't feel anything. And really, it just is amazing to me. So I've talked to people who are very squeamish about it. I always said I would never do LASIK surgery because, again, the idea of the, going into your eye or something like that. But it isn't like that at all.
No.
And it's amazing.
You get a little sedation, so it's like a 3-martini lunch without the hangover, right? So it's nice. It's a good thing.
Yeah, I mean, it is amazing. And the fact that you can restore people's eyesight is phenomenal. So if you let cataracts go and it gets to the point of the cloudiness that you showed, it's totally irreversible?
No, it's totally reversible.
Oh, even at the point of total clouded
So you could
vision.
just barely see light. And if we take the cataract out, and I did a mission trip a couple of years ago, and we were seeing patient after patient that had those, and even in Annapolis, I still see many people, probably one a month, that are totally blind from cataracts. But you take the cataract out, and in a couple of days, they're seeing well again. It increases the risk a little bit when you do it. It's a harder procedure when you wait that long, but it's totally reversible.
That's fantastic. And what about LASIK surgery?
So LASIK surgery is no more.
Yeah.
It's all bladeless now. It's all laser, and here we're working on. Remember, I told you that the cornea could be either too steep or too flat, and so what we do is we make a very thin flap, reshape the cornea underneath the flap, and then put the flap back down again. So instead of you're doing the same thing. Both of these are refracting surfaces. And so you're either changing the shape of the cornea or you're changing the shape of the lens to allow the light to focus on the back of the eye.
Yeah.
So nearsightedness, farsightedness, cataracts are things that we can take care of and cure. Other things like macular degeneration or glaucoma are not cures. We want to just try to keep your vision longer than you. So to move on to glaucoma,
I was just going to say,
it's more like high blood pressure. You don't know that you have a high pressure in your eye that's causing damage, so if you don't see a doctor, you would never know. And because it affects your peripheral vision before your central vision, you wouldn't know until very late in the disease. So that's very important after the age of 40 to see a doctor every 2 years, just to make sure that's not happening.
Oh, I'm sorry, go ahead.
I'm sorry, because it's something that we can really control with drops or laser, and it would be horrible because you can't reverse the damage.
Well, that's what I was going to say. I remember years ago that there used to be, when you, and I know everybody's freaking out about this too, but there would be that sort of a thing that would get put on your eye, and now it's just a puff of air.
And not even
So-
that. I mean, it's, you know, that blue light that we do in the office, you don't even feel it. It comes very close to your eye, it checks your pressure, so you don't even have that puff coming back.
And at what age, as you say, about 40, you should start getting that tested, or?
Well, if you get in earlier, you know, as I said, if you come 4 or 5 and then they find you don't have any problems, you're probably good for, 4 or 5 years. But after the age of 40, you probably should see an ophthalmologist or an optometrist every 2 years.
So everyone should, whether you have problems with your eyes or not.
Yes, because many of the problems you don't know you have.
Yeah. And can they sneak up on you, as you say that they do, but is there something like cataracts, very slow growing, glaucoma moves fast? What is it that if you even have a suspicion of something immediately, and what are the things that you might be able to let sort of go?
No,
Nothing?
No, cataracts are very slow growing in most patients, and cataracts are something you'll know about. You'll see the signs and symptoms, right? You won't be able to see well at night. The things that I talked about earlier. Glaucoma, like I said, usually you don't know until very late in the disease. Macular degeneration is slow in most people, and you'll notice that as well, but it can advance to the wet form very quickly, and then it's much harder to treat. So, again, getting checked. Glaucoma with drops, you can really keep it and keep your vision your whole life and never have any damage. You're just being managed, just like high blood pressure would be.
Yeah. Oh, that's great. So we just have a minute or two left. Is there anything that you especially want people to know, other than you should always wear sunglasses, even on a cloudy day, do you
Yes,
think?
you still get UV.
Yeah.
Yeah, absolutely.
And
Yeah.
are there like strengths of sunglasses that you would suggest, or you could go to
Luckily in the
grocery
U.S.,
store?
everything has to be 100% UV now.
Oh.
So even if you bought your, Rite Aid glasses or your dollar store glasses, they have to be 100% UV.
Really?
So go for the frames. Polarized lenses, that's more a personal preference and comfort. But just get your eyes checked. Don't let that go. There's so many things you can do and see
Yeah.
more clearly.
But no vitamins, no food, no exercises or anything like that really...
In rare cases, exercise help people, and that's usually for muscle disorders. But foods, eating a healthy diet, again, high in antioxidants, has been shown. And for people that have macular degeneration, antioxidant vitamins have been shown to make a difference.
And is there anything else that we have about a minute left, that you really want to impress upon people, that if you remember nothing else about this interview, remember this?
Make your appointment with your eye doctor.
That's a good
Do
one.
that. And don't be afraid. I mean, we'll give you medication to have LASIK. We'll give you drugs to have your cataract surgery. You'll be fine. Don't be afraid of it.
Yeah, and I heartily agree on that, because I really was. And I have to say, I was a nervous wreck, honestly, waiting for that surgery, that first one, to happen. And then for the second one, it was like, yeah, come on, let's do it.
I mean, that's the wonderful thing, is the next day when people say, can we do it earlier? You know,
Yeah.
can we do it tomorrow?
Yeah, it really is an amazing process. And certainly to think that this process, as opposed to going blind irreversibly, it doesn't make any sense to put off getting the eye exam and eating healthily and wearing sunglasses and doing all those things.
I'm so fortunate to be able to do what I do. I mean, to be able
Yeah.
to restore someone's sight is
Yeah,
such a high.
It is. It's amazing. And to be the one who has it happen to them is amazing as well. So I want to thank you all. I want to thank Dr. Scott again.
Thank you very much.
And if you would like to have more information, you can go to the Montgomery County website or ChesapeakeEyeCare.com, or call 877-DR4-2020. Of course. Thank you so much for joining us.
Thanks so
Thank
much,
you
Pat.
all for joining us. We hope to see you again on the next episode of Connecting Our Community. And you can also go to the Connecting Our Community blog on the mymcmedia.org website. Thanks again for watching. Be sure to make your eye doctor appointment,
Yes.
and we will see you next time for another Connecting Our Community.